Effective today at midnight, all bars and restaurants will be only permitted to remain open until midnight. All adult entertainment clubs will be closed right across the province. All businesses and organizations will be required to implement screening procedures for their workers. And tomorrow, going forward, restaurant and bars must stop serving alcohol at 11 p.m. and close their establishments by midnight, except takeout service or delivery.
New restrictions, as you can hear there, for bars and restaurants in Ontario as the province sees another day with more than 400 new COVID-19 cases. Over in Quebec, where 637 new cases were reported today, the government made this plea to Quebecers.
We are asking of you to make it a special effort to limit your contacts for the next 28 days. And I insist on this. It is for a month. This is not permanent. We ask you a month of effort to break the second wave.
For more on these new measures, we've reached two doctors. Dr. Zane Chagla is the medical director of infection control at St. Joseph Healthcare in Hamilton. He joins us from Mississauga, Ontario. Dr. Gerald Evans is an infectious disease specialist at Kingston General Hospital and chair of the Infectious Diseases Division at Queen's University. He's with us in Kingston. Hi to both of you, doctors. Great to see you. Thank you.
Oh, thanks for having me.
Dr. Evans, I'm going to start with you. We spoke to your colleague, Dr. Alison McGeer, yesterday. You both signed a letter, 38 doctors, writing to the province, asking for more restrictions. Is this what you had in mind in Ontario, I should qualify?
I guess I'd say partially. We really felt that some closures would be needed to be done. And certainly, I think we need to be looking at local measures. This restriction on bar hours and restaurant hours is a good start, but BC was already there about 2 weeks ago, and we are now into a early part of this second wave, and I think we need to be very quick, and we need to get to action right now. And it's getting there, but I think for some of us, where we've looked at super spreader events arising in bars and other places, we would have liked to have seen some closures, if not across the entire province, at least in different regions.
So let me just follow up with you for a second. Do you mean the closures completely of restaurants and bars, or do you mean even further restrictions on hours?
I think bars, nightclubs, and dance clubs, we would have liked to have seen some closures completely, and the reason for that is that we know when you go to a bar, you're there to socialize and to drink, but that's a bad mixture when it comes to this particular virus.
Do we know that there have been like a big portion of the cases come from there? I know that we heard from restaurant owners this week, for example, who were worried about a lack of. They didn't know where all the cases were coming from because the data isn't that available to people in Ontario. Do we know that bars, for example, are where this spread is happening? Because the politicians keep telling us it's backyard barbecues.
Yeah, that was certainly what was being pushed about a week and a half ago. But there's a good recognition now that bars, nightclubs, and again, establishments like strip clubs are actually the place where a significant portion of cases are beginning to arise from. So this is not a surprise, and it's certainly something that we've seen in multiple jurisdictions around the world. Dr.
Chagla, let me ask you about what we heard from the Quebec minister there in that clip. And that is, I think, a pretty tough message for a lot of Canadians to hear. It certainly feels different than what we've been hearing at least since June. How necessary is it, do you think, that people who live in provinces where the numbers are really going up, or that we have quote unquote entered a second wave, really stop getting together with people?
Yeah, I mean, I think it is an aspirational goal for the Quebec government and really telling their people, these restrictions that we can have, as we talked about, of bars, restaurants, of gathering limits. They're great, but it still doesn't prevent transmission inside people's residences, which, even if it does happen in the community, can amplify in people's homes. And so it is an aspirational goal. It's not going to obviously fit with everyone, people who need childcare, people who live with their parents, people who support others. But I think if everyone takes a look in their lives and says what kind of optional events or what kind of optional hangouts I can have, or when can I do it outside in a more safe setting, it's going to help with this down the road, and it's going to help with the stuff we can't police and we can't enforce.
So Dr. Chagla, I'll follow up with you and ask you what I think is probably what's going through most Canadians' minds, kind of a practical question of what that means for their lives. If you're planning to get together, let's say, with your grandparents on Thanksgiving, should you not?
Yeah, I mean, hopefully the weather is good for us and that type of get together can be outside. But we really do have to think about this. If the rates are going up, there's a good risk that you're putting a vulnerable population at risk in Thanksgiving. And there's obviously concerns about Thanksgiving because people travel to see other people and then go back to their respective communities. It's the type of event that could amplify things in very low risk communities as well. And so I think we really, really have to be careful going into this. And certainly if rates are rising and it can't be done outside, we really have to reconsider whether or not we can do a true Thanksgiving.
Dr. Evans, when I was speaking with Dr. McGeer, she was saying, much like you, that it's probably going to have to be stricter restrictions that come into place, but that it's not like it would be forever. That you could look at a timeline, for example, even of a month where we went back to thinking like we did in July or August, not even in March, and that could have a germane effect on what things look like a few weeks beyond that or even a month beyond that. Like we're at a really important juncture, basically, where you kind of got to buckle down for the next month, but keep in mind, and I wonder if you agree, if we can be a bit optimistic that this isn't, the next year like that in a lockdown situation.
Yeah, absolutely. I would agree with my colleague, Dr. McGeer, and I agree with Dr. Chagla's comments as well. This is, if the expression is right, is short-term pain for long-term gain. We are clearly at an inflection point in the second wave where, significant reductions for a period of time, but not for a long period of time, can have a really dramatic reduction in flattening that curve, preventing an overwhelming entry into long-term care where we know it's dangerous, which then results in hospitalizations and deaths. We have got to keep hospitals and schools open so that we can continue to, do the work that got delayed in healthcare during the spring months and to allow children to get back to school and their education and all of those sorts of things. So, yeah, a short-term effort, I think, is going to pay huge dividends in the future and prevent us from having to go into a really prolonged shutdown.
Dr. Chagla, I want to pick up on what Dr. Evans said there, particularly about schools and hospitals, because that is one big difference from March, for example, where all surgeries except life-saving ones were canceled, where kids couldn't go to school. Is it possible, from your perspective, if there is a collective effort to limit contacts elsewhere, that schools can stay open through what is potentially a severe second wave, and that not only schools but hospitals can continue doing those surgeries and those activities that Dr. Evans referenced?
Yeah, I mean, I think that's the last thing to close. I think that's our last post on the list of things that we can close beforehand. We know that obviously hospitals and the care that's provided to people outside of COVID is important. It's life-saving, and we don't want a second wave of mortality associated with having to shift our system towards COVID. And obviously the mental health and well-being of our children involves schooling. So, I think we can coexist. We've learned a lot. The moves today and the moves going forward are going to be part of the dance of keeping things under control while still maintaining semblance of living with this virus for the foreseeable future. But I do think, those are the last on the list, and we really have to preserve everything else before we get to that point.
Okay, I'll leave it there. Thanks very much to both of you for your insights this evening. Appreciate it as always, Dr. Zane Chagla and Dr. Gerald Evans. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.